So as I said, I have got doctors in the house today. I am so happy because we're going to be answering questions that I know a lot of you have, such as, what kinds of treatments warrant going to see a chiropractor? Is chiropractic treatment safe, even for infants and children? Why is there a popping sound during my treatment? So I'm talking with the chiropractic physicians of Advanced Physical Medicine Chiropractic and Wellness Center in North Haven this morning. They are located at 444B Washington Avenue in North Haven, Connecticut. Their number, because I'm going to give you all this information again, because I know you need time to go get a pencil, but I know you're going to want to give them a call after this interview. It's their number is 203-691-5581, or you can go to their website as well. They have a lot of great information on their website, www.ap as in Persimmons, APM as in Mulberry Street, apmct.com. That stands for Advanced Physical Medicine Connecticut, apmct.com. So in the house this morning, I have with me, good morning, first of all, doctors.
Good morning.
Morning.
Good morning. I've got Dr. Candace Pollock, who knew she wanted to be a doctor ever since her graduation from nursery school. My goodness. Wow. That's so amazing. And I guess it is true that some people really do know from the first time they could think, basically, where they're headed in life in one way or another. So Dr. Pollock, during her basketball career, she sustained a low back injury, which prompted her first encounter with a local chiropractor. And during her office visit, Dr. Pollock's dream of being a sports medicine doctor was realized. And that is exactly what she wanted to do when she grew up. That's what she's doing now. She's a graduate of Hamden High School, where she participated in women's basketball and lacrosse. She then continued her basketball career for 2 years at Albertus Magnus. I love that school. I taught at that school years back, followed by obtaining her Doctor of Chiropractic degree and Master's in Clinical Nutrition from the University of Bridgeport. Good morning, Dr. Pollock.
Good morning.
Great to have you here this morning.
Thank you.
And I also have Dr. Max Mitchell. He's been influenced by sports from a young age as well. So it's no surprise that his favorite sport, basketball, would point him to his future profession. While playing basketball at Sacred Heart High School in Waterbury, he discovered one of his coaches was a chiropractor, which piqued his interest. Over the next couple of years, he would look into the profession while finishing his bachelor's at Quinnipiac, another great university, as is UNH, by the way, University of New Haven, because we're, doing the show from there, and it's a wonderful school as well. He decided that chiropractic would be the profession for him. Dr. Mitchell received his Doctor of Chiropractic degree from the University of Bridgeport, where he graduated magna cum laude. Wow. Welcome to the show.
Thank you. Good morning. How are you doing?
So nice to have both of you here, doctors. So I've got a lot of questions, because there are some common questions that people want to know about chiropractic treatment, and I'm sure you get them all the time. But I think the real shame is a lot of times people stay away from a chiropractor because they have these questions and they don't know who to ask. They don't feel confident enough to just pick up the phone and talk to a doctor and ask them directly. So, they hear these myths, and that's what I want to dispel this morning, a lot of these myths, and give people, listeners of the Art of Living Well, some great information about chiropractic treatment. So we'll start for the first one. First of all, what kind of conditions does a chiropractic doctor treat?
Well, basically, we treat all musculoskeletal injuries, per se. Sprained strains, we treat a lot of weekend warriors.
Yeah,
What's a weekend warrior?
Well, weekend warrior is someone who during the work week isn't really able to get out there, work out, do things like that, and then on the weekend they go from 0 to 60, and they go play 36 holes of golf. They go play softball, flag football, and they wonder why they're sore the whole week. So that's pretty much what weekend warriors. And that's one of our main clientele that comes in, is those people that come in and they don't know why they're hurting so much, but they don't realize that when they played basketball, maybe when they were 15, 16, their body was able to regenerate and recoup from injuries a lot quicker.
So Dr. Mitchell and Dr. Pollock are in practice together at the Advanced Physical Medicine Chiropractic and Wellness Center in North Haven. I'm wondering, doctors, are you getting more of those weekend warriors since the Olympics have been on? I mean, do people now think they could, be a triathlon athlete?
Yeah, the Olympics, I think, are definitely pushing people to do things they normally wouldn't do and push themselves a little bit more, just because everybody's so inspired right now, just with the American spirit and everything. So we've definitely been seeing...
You've been seeing some of a rise in that kind of injury. So that's really, so musculoskeletal kind of injuries. What about preventative wellness? How does a chiropractic doctor approach that? If someone comes to you and says, look, let's say I'm reaching a certain age, I want to make sure that I keep my, skeletal system strong. I mean, I just had a couple months ago, really, I broke my ankle. And it was just walking. And my ankle went under me. I fell on top of it. And that was it. Boot, cane, physical therapy, the whole bit. What about if somebody comes to you and says, look, I don't want this to happen to me. Is there a way I could come to you for preventative care? How would you approach that? Dr. Mitchell?
Well, each patient is different and is different cases, so we approach each patient separately. So for you, example, maybe we would have done is a exercise program to prevent things like that from maybe weak ankles, and a rehab program specifically tailored towards you. So we would have gone through all the exercises with you, walked through them with you, and each time you came in, went through them with you to make sure that you're doing them correctly, because a lot of times we'll give patients the exercise the first time, they come in the next time, ask them to do it, and they don't know they don't know what they're doing. So we'll go through them each time with patients just to make sure they're doing things correctly, because if you're not doing them correctly, you can actually injure yourself worse.
Even more, yeah. Now, do you need a referral from an MD to see a chiropractic doctor, Dr. Pollock?
Not in the state of Connecticut, no. We're actually primary care physicians, so you can just walk right into our door. No
And
referral.
Insurance covers it as well?
Yes. They won't
That's
cover
amazing.
wellness care, so if you were one of those people who wanted to come in 4 times a year to get adjusted, insurance won't cover that, but they will cover it on an injury.
For injury and you sprain or whatever it is, broken, whatever. That's really great to know. And you know what I like about it, because I was reading your website, and by the way, their website is www.ap as in persimmons. Does anybody know what that is anymore? Persimmons? It's a fruit no one eats anymore. Can I think of another thing for P? Paul
or Peter.
Peter, APM as in Mary, CT, apmct.com. That stands for Advanced Physical Medicine, Connecticut.com. One thing I noticed about your website is you address the whole package, including nutrition, weight control. I love that. So as a primary care physician, I mean, you really could look at the holistic picture of your patients.
Yeah, we definitely try to look at our patients as an overall, try and help them through different aspects of their life, so this way they can, get control of everything. A lot of patients come in and they have musculoskeletal complaints, but they actually have a lot of other things going on too, so we like to be able to help them in any way we basically can. On our website, it says we strive to develop a partnership. We're more than just, the chiropractic doctor for our patients. We like to become involved in their lives and to, be the first person when they're hurt or have any questions that they call us, and that they trust us like that, because we like to develop the partnership and be involved with them.
I love that. And, as young doctors, I mean, you also are very into social media, which is important now because people want to. I notice you have a Twitter account and a Facebook, and we are already linked up on LinkedIn, and, doing that is a way to establish a presence for those who are into the social media too, so that they can feel more connected. There's a live presence, there's a stable presence in the internet as well as in your actual practice, in your, brick and mortar practice in North Haven. So I really do like that. is chiropractic treatment safe? Because, a lot of people have these images of kind of like dungeons and, equipment and people like hoisting themselves onto your back and, stretching you on one side and then the other, as they used to do in the, old days of medieval torture. Not so, though. Tell us about the safety of chiropractic treatment. Dr. Mitchell?
Chiropractic treatment is actually very, very safe. There's little to minimal side effects that people can find. We'll get a lot of people that come in and have these horror stories or these things that they believe that they saw on TV. A lot of things with, I think, 2.5 Men, they see with that character and how a chiropractor acts. And they don't realize, the schooling that we went through and all of the hours we put in studying and the boards. And it was 4 years after undergrad of school that we went through, and we learned a lot, and we went through many, 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 many hours of studying for boards and tests, and it's a very safe and very rewarding practice that we have.
Yeah, I think people don't realize that a doctor of chiropractic medicine really has to go through rigorous and long training. Yeah, so it's not, it's not just, because I think people, in a lot of, let's say, alternative areas, don't have the standards and so forth that are more traditional. Because really, chiropractic has been around a long time, going back to, was it Palmer who,
1895, yes.
1895. So, I mean, it's a science that continues to evolve just as does the traditional MD and their training. It's just a kind of a different pathway, isn't it?
Yes. Yeah. We like to say that everyone has their different paths in the medical field, and everyone could work together. If everyone works together, we can have the person as a whole be the best they can be. And a lot of patients come in and they don't realize it when they see that we'll work with their MD or their orthopedic surgeon, their physical therapists. Then they see that they get that whole care, and they're very, very pleased to see that it's different maybe from the past where chiropractors and MDs maybe didn't talk as much, they didn't communicate, so you didn't know what was going on one and the other. So with us working together, patients have really, really responded very well to that, and we know we can't treat everything, and we will send someone to an orthopedic surgeon or MD just as quickly as now people are starting to send them to us.
See, and that's the way it should be. I mean, refer to each other when there's a specialty that you don't particularly handle, so to refer someone out, and that makes a person feel confident and safe that when they're going to you or they're going to their, more traditional medical doctor and they refer them to you, that, I mean, you're all working together for my health, and that makes me feel good about having chiropractic as part of my treatment. So the popping sound, Dr. Pollack, what the heck is that about?
Well, basically, there's a pressure change that goes on within the joint capsule when you're adjusted, and that pressure change causes gases to be released, and that's the popping sound you're hearing. It's basically equivalent to, opening a soda can and the pressure change, and you hear the tss sound because the gases are being released. That's the same thing with the joint capsule when you're
So that's a
adjusted.
good thing then, right? It's a relief. In other words, when that gas is released, now the muscle is it the muscle what is popping anyway? The joint.
Yeah, it's just a joint capsule. It's just the pressure change makes the sound.
And it's not a big deal, nothing to freak out
No.
over. Because I don't like sounding like popcorn. What about children and infants? I mean, you think about chiropractic being more for adults, but how about children and infants, and when would they come to a doctor of chiropractic?
Well, both children or infants, first of all, I've seen and heard of infants that have been adjusted right after birth, because the birth process is such a traumatic process that when they come out, their head might be a little off, their hips might be a little off. So I've heard of many, many chiropractors that have adjusted infants right out of the womb, actually. As far as children, it's very, very safe for both children and infants. Children and infants actually are more likely to heal a lot quicker because that's how their bodies are when they're younger. They're able to heal quickly when they're injured. So chiropractic is actually very, very good for them because, as we know, all children, they're jumping, running, flying off trees, things like that, taking these little bumps and bruises. So these things with chiropractic, it's very safe.
I'm talking again with doctors Candace Pollock and Max Mitchell, both doctors of chiropractic medicine at their practice in North Haven, and they are at Advanced Physical Medicine Chiropractic and Wellness Center at 444-B Washington Avenue. Everyone knows where Washington Avenue is in North Haven. It's kind of like the main road there. Their number 203-691-5581, or you can visit them on their website for a lot of great information, www.apmct.com, apmct.com, and they're also on Facebook and Twitter and all that good social media. We were talking about, is it safe for infants and children? Is chiropractic medicine safe for them? When I was in 4th grade, I remember my teacher had just had a baby, and my grandfather was a shoemaker. And she came into me one day and she said, she brought baby shoes, and she said, bring these to your grandfather and have him glue the two soles together, because her baby was born with, I don't know what kind of bone kind of deformity, which you don't hear of that today. But I'm wondering, at that time, might that have been something a chiropractor would deal with if a baby was born and their joints or their bones were somewhat misaligned, as opposed to that. So actually this baby had to wear these shoes. I can't imagine. But the soles joined together until their, wow, legs were,
Yeah, it sounds like something chiropractic might have been able to
work with. Exactly. Now, does a chiropractic doctor prescribe medication?
This is a question we're asked very often. No, we do not. We have no prescriptive rights to prescribe medication. We try and use more holistic, alternative, natural means. We've recently started using a lot of homeopathic medication, I guess you could per se. And we've found
formulas like the pellets,
and creams. Yeah. Now they have nasal sprays. They're coming out with so many different products, and we've definitely found a lot of success with that. So
what I love about, and I saw a little photo of your office on your website where it said, pain is not a lifestyle. I love that. Because I think sometimes, too, and obviously, when you need medication, your medical doctor will prescribe it for you. But I think sometimes we rely so much on medication that we don't explore options that could free us from pain that are totally natural. I hate to take pills. I'll tell you, I really do. I hate to take medication unless I absolutely have to.
Yeah, a lot of people, I think, are starting to follow that trend. They're just sick of being bombarded with all these different prescription medications. They are necessary for certain conditions and certain times. You definitely need them. But I think a lot of people are, if they have high blood pressure, they're more willing now to get out and start walking and focus more on their diet versus, popping the pill that's going to help them.
And that's becoming so important. We see it in the news all the time. I mean, the incidences of obesity-related illness and, even stress, which becomes a lifestyle if you're constantly bombarded by stress. And it affects, I imagine as well, your muscles and the way even an injury like mine, I have to say, if I had been maybe more mindful of the road I was walking on, I might have been able to avoid that, but perhaps I was thinking of something else. But tell me, when a person goes in to get treatment and they feel sore afterwards, is that normal? Is that okay? What do they do with that?
That's actually a normal finding that we'll have with patients after they get treated, because we're moving things around, we're getting things back into place. Just as if you went to the gym for the first time, people with their New Year's resolutions go to the gym for the first time in months, and the muscles are feeling sore. It's the same thing with chiropractic treatment. The first couple treatments, you might feel a little soreness, but we're moving things back into place. The muscles are getting stretched that haven't probably been stretched or worked on almost in years, or maybe sometimes in some cases ever. So the soreness is definitely something that it happens, not for everybody, but it's something that it's commonplace, and it's not anything to be scared of or nervous about. What we like to tell our patients is, being sore is better than being in pain. And that's something, it's a good soreness to feel that you've been working on that muscle, you've been exercising, things like that.
And it's kind of saying, thank you
Yes.
for using me.
Yeah, it shows things are changing.
So you must get a lot of, there are a lot of students that play sports, and a lot of older people play sports. I actually have a cousin from Italy who is in his 60s, and he's a goalie for a local soccer team. So I just marvel at the fact that he could bend down and get up, without his knee, because it's hard, on your joints to do that. So in terms of sports, sports injuries, when is it time to come to you as opposed to say, well, all right, I've done that before, and yeah, I've had that pain in my knee before, so, it's all right. It's nothing to red flag me about. When is it time to come and see you when you have a sports injury? How do you know?
We say a lot of times, achy is better than sharp. Any sharp pains or anything, you should definitely get in to see some type of physician sooner than later. If you've been dealing with some kind of achy, sore pain that has been lasting, I would say, longer than a couple days, it's time to get in and get checked out too.
Yeah, we usually give our patients it's called like a 2-day rule. So what we'll say is we give you the tools that should help you kind of heal up if you kind of have some achy soreness going on. But after 2 days, if after icing or heat, stretching, things like that, if it's not feeling well, that's when you should get in. The quicker that you get in, the quicker that you'll be able to recover. The longer people wait that they want the magic pill, if they wait 2-3 weeks, some people wait months that they want it, and they want to come in once and things to kind of get back to normal. But that's not the way the body works, as we can see. If you go to the gym and you want to lose 5 pounds, it doesn't happen in one day.
It doesn't?
So what we try to preach to or tell our patients is that, when you feel that achiness, soreness, that pain, sharp pain, if it lasts more than 2 days, get right in and we'll fix you up. And things usually go a little bit quicker as if you get in right when it start to feel it.
All right, that's a good guideline, because we all sometimes are on the fence and we say, well, should I, shouldn't I? Is it, am I being a baby? If I, or should I tough it out, or how much should I tough it out? So that's a good guideline. I'm here talking with Dr. Candace Pollock and Dr. Max Mitchell, partners in the practice of Advanced Physical Medicine Chiropractor and Wellness Center in North Haven on 444B Washington Avenue, number 203-691-5581. Lots of great talk, giving us insights about what the practice of chiropractic medicine is all about. Now, how does a chiropractor, how can a chiropractic doctor improve sports performance?
That's a great question, especially right now with the Olympics going on. There's a lot of documentation about the chiropractors being overseas right now with all of our Olympic athletes, and there's actually pictures of them getting adjusted. And a lot of times they're not in pain. They're just getting adjusted to keep their performance at the top level that it needs to be at for them to perform. And basically what they're getting adjusted for is any little joint restriction you have is going to alter, the function of the body, of the muscles, and, split seconds matter to them in these Olympic times. So any athlete who wants to be at their top level of their game is pretty much getting adjusted just to keep their body in the highest level it needs to be at.
Yeah, just to follow up on that, we've seen a lot of pictures of people like Usain Bolt. We've seen articles with Michael Phelps. And they're getting a lot of the treatments that chiropractors do that we do in our office. And that, like Dr. Pollock just said, it's just to keep themselves at their peak performance. They know that if they don't have that little bit of soreness left over, that might be that extra second, that might be that extra inch that the gymnastics people might get on that backflip and things like that. So these are things to think about.
Are either of you doctors available for team, to team kind of sports, like to travel with teams or what have you? Have you thought about doing any of that, or?
That's something we're definitely thinking about and definitely want to. That's why we actually got into.
Sounds like you're both so passionate about that, about helping people perform, perform better, and also treat them so they could get back out there and enjoy doing the sports that they love and their everyday activities. Because as people age, it's also about functional kind of the ability to lift that bag of groceries still and go up the flight of stairs and, walk your dog with one hand and, talk on your phone with the other without falling. So all those kinds of things, right?
Yeah.
But that is also something else I was curious about, whether you do that, whether you travel with sports teams or, maybe someday would open your practice up to that, maybe partially doing that.
Yeah, we kind of, we don't right now we're not with any sports teams. We're definitely open to it, but we've been working a lot with the CrossFit in North Haven. We've been in the gym, treating some of the people who go there. They're probably the first place that we've really linked up with.
Well, that's another actual interesting avenue, because people who go to the gym, especially those just getting back to the gym after a long absence, would have all that achiness and soreness and maybe even hurt themselves if they're not used to the equipment. So if they come to you and say, well, look, isn't it easier for me just not to go to the gym then? What's the rationale? Do you do a little bit of that motivational kind of thing too?
Yeah, we have to definitely motivate some people, because they'll get very discouraged very easily if they go for that first week. And as you said before, they go from 0 to 60. They think, I haven't done anything in a couple of years, but I'm going to run a 5K tomorrow. And then they come in and they can't walk. They're bent over, leaning to the left. And you just kind of have to let them know that this is what's going to happen. Maybe you have to scale it back a little bit. Maybe not run that 5K that first day. Maybe just walk a mile. And just getting that little bit of motion into your body is going to just make the world of difference. And just people realizing that it's been very, very interesting seeing that.
So I'm talking with Drs. Candace Pollock and Dr. Max Mitchell of the North Haven Practice Advanced Physical Medicine Chiropractic and Wellness Center in North Haven. Doctors, do you ever look at, let's lay it on the line here. You work with the musculoskeletal system. Do you ever just have to say to someone, you just need to lose weight and take some of the pressure off your musculoskeletal system?
Yeah, we do. Unfortunately, a lot of patients don't like to hear that, especially, we're younger doctors, and a lot of the older patients don't really want us telling them, you need to lose weight. But when it comes down to it, they need to, just for their health, for,
Absolutely.
they really want to get better. That's what they need to realize, that they need to lose this weight and get outside and get moving.
Yeah, because I couldn't help but notice when I was going through physical therapy for my ankle, there were a lot of people going for physical therapy that were just really very overweight. And I couldn't help but think that if people take off, if we take off the weight we need to take off, is our treatment that much more effective if we do that at the same time and just give our own bodies the best shot it has by eating right?
Definitely. And as we said before, the pain is not a lifestyle. A lot of people think that when they get older, maybe they put on a little more weight, that's just an inevitable thing to get in pain. But people don't realize, what we're trying to tell people is that you don't have to be in pain when you turn 40, 50, 60. You can still do the things, as you said with your cousin, I think that's playing soccer and being a goalie at the age 60. People are still doing these things, and you're seeing that more and more as I think the world is starting to change a little bit towards that. It's all about
quality of life, isn't it?
Absolutely.
Yes.
So,
exactly.
So listen, I would like both of you to stay for one last segment, a question segment. I've got some more questions and a couple from our email viewer listeners. So can you stay for a few more minutes?
Definitely.
Okay, so don't go anywhere. You're listening to 88.7 West Haven WNHU.
For the best in traditional contemporary folk music from North America and the British Isles, tune in every Thursday at 8 p.m. and every Saturday at 12 noon to 88.7 WNHU.
WNHU West Haven, Connecticut's #1 college radio station.
Come on, come on, come on, come on, now touch me, babe. Can't you see that I am not afraid? What was that promise that you made?
What a great day to be alive today. You're listening to The Art of Living Well. I'm your host, Raylene Mautner. Good morning. Thank you so much for joining me in Connecticut, Rhode Island, New York, Massachusetts, and all across the country and across the world with live stream at WNHU.net. I'm so proud to have you with me and glad of being able to share with you some great information. I've got Drs. Candace Pollock and Dr. Max Mitchell in the house from Advanced Physical Medicine Chiropractic and Wellness Center in North Haven, 203-691-5581, or of course you can go to their website, www.apmct.com. We're talking about the practice of chiropractic medicine, and there's a whole bunch of great questions that we've been addressing. When I was in grammar school, a young girl, the nuns used to take my shoulders. I was the tallest person in the class. Girls grow faster than boys, so I was always the tallest one. So they would always line me up at the back of the line, and I would try to slump because I didn't want to be tall. I wanted to be petite. And so the nuns would just take my shoulders and crack them back and tell me I had to stand up straight. I don't know if that was a chiropractic treatment or not. But posture is important, isn't it?
It's huge. I just don't think people realize how important it is.
Why is it so important?
Well, as we're all sitting here right now, the whole Western
world, at least
we're all hunched over. We all sit at desks. We're all driving and using the steering wheel. We're all sitting at computers, and we all tend to get this hunched over posture, which actually leads to the muscles in our back that are between basically our two shoulder blades. They become weak and they forget how to do their job. And this leads to a lot of muscle tightness in your neck and a lot of pressure up here. That's why a lot of people are getting headaches. Their shoulders are sore, their neck is sore, and that's basically due to posture.
So we've been thinking about sports injuries, but the injuries of doing a desk job, really, I'm a writer and I'm coming out in addition to having a full-time job, I'm coming out with a new book for next spring. So any free time I get, I have to keep in that chair or I don't get my writing done. If I get distracted, even with a phone call, it takes me like another 20 minutes to get back into what I was writing. But at the end of the day, I notice, ouch, wrist, neck, back. So you don't only treat sports injuries, but these are just kind of lifestyle injuries, aren't they?
Yeah, everyday injuries that people might realize that they're doing or not doing. We like to say we treat everybody from, people who are gardening to who want to run a marathon.
Gardening, yeah.
Yeah. So people, as you were saying, you sit there, and if you don't have the proper ergonomics where you have your back straight, your neck up, where your wrists and elbows are properly.
Carpal tunnel, right? You treat that as well.
Carpal tunnel, things like that. And people will think, they'll get maybe some pain going down their arm, and they think it's a nerve or think they have a pinched nerve, but actually it's just poor posture. And if you just work on that posture, do proper exercises, you're going to relieve so much pain.
I love that approach. It's a proactive approach to your own wellness. So would I be right in assuming, Dr. Pollock, that you are not an advocate of immobilizing? Like when somebody has carpal tunnel or when somebody has, whatever, and they immobilize, a lot of other treatment methods involve just keeping it perfectly still. When I hear you talk about rehabilitative exercises and movements and so forth, am I correct in thinking you are all about getting that movement back right from the beginning?
Yes, there are times when you do need to be braced. If you do immediately sprain your ankle and it's swollen, you need to be braced for a little bit. But as soon as you can get motion into that joint, the better off you are. Even surgeries now, patients are going in to have knee and hip replacements. They're getting those patients up and moving immediately, as quickly as possible as they're able to. Yeah,
that makes a lot of sense to me. Why did you open your own practice? Was there like a reason why you decided, I want to open my own practice as opposed to maybe going to join someone else's practice? What was your vision for opening your practice?
Well, while in school, we actually always talked about, as we stated before, we're both into sports. We always talked about we want to open something that was sports-oriented to help the athletes of, a certain area we weren't sure, because I'm from Waterbury, Dr. Pollock's from Hamden, but it's still a pretty close area to find, the sports injuries and things like that. So we always talked about that, and we just had the opportunity when we got out of school, a couple months out of school. We just had this opportunity. We took it, and it's been a dream ever since.
How wonderful. A dream realized. I'm all about that. I love that. And I'm so fascinated with how you knew right from nursery.
Yeah.
Did you know that early, Dr.
No.
Mitchell? No.
I didn't know that. I kind of had an idea in high school and college. I always knew I wanted to do it in the medical field.
Yeah.
But I wasn't sure where I wanted to go with it.
So you had a calling to treat people, to help people,
Yeah.
to heal people.
Yes, exactly,
I love that so much. So I have an email question for the doctors this morning, and actually a couple of them, and I was asked to ask you this on the air. So how can you determine if soreness from a workout is just sore muscles or an injury without going to the doctor, is the first question. Can you determine that yourself?
Well, it's basically back to our 2-day rule. I mean, anything achy and it doesn't subside within, a couple days, get in to see the chiropractor. Sharp, like we said before, is not as good as achy. Sharp is something you probably want to get checked out sooner than later. But anything that lasts 2 days or so, you definitely want to get in and have that looked at, just to be sure that, even you might be getting sore from working out, but you might be doing something wrong while you're working out. So even just talking with the chiropractor about what you're doing will definitely help.
Okay, and the follow-up, which you answered part of that in giving us a time guideline, but the follow-up to that is, how long should you wait before going to the doctor if you ache after exercise? I realize any radiating pain down a leg or arm is possibly serious, but is feeling sore and achy a normal side effect of a generalized workout?
Yeah, sore and achy is definitely a normal thing that you're going to feel. Anybody's going to feel after a workout. But as we said before, 2 days, you get to that 2-day point and it's not really getting that much better, that's when you should definitely give a call to your medical professional, chiropractor, whether it be chiropractor, MD, physical therapist, to get in and, as we said before, get that fixed early so you're not dealing with that when it becomes a chronic issue.
Excellent. I'm here again talking with the doctors from Advanced Physical Medicine Chiropractic and Wellness Center in North Haven on Washington Avenue. 203-691-5581 is the number for their practice, and I'm sure they'd be glad to talk to you if listeners have additional questions or are deciding if they need to come in and see a chiropractic doctor. After treatment, doctor, after treatment, post-injury, at what point should a person start to exercise? By that I mean, if I've been running 5 miles, should I start out running 1 mile post-injury for the first week or so? Basically, where and how does one start exercising after a muscle pull or sprain?
Well, basically, everyone's different, so it's going to be on, based on what injury you suffered. But the one rule we definitely tell all of our patients and kind of spread the word about is a 10% rule. You only want to increase your intensity, distance, weight by 10% each week. So if they were originally running 5 miles, I don't even know if you would want to start out with 1 mile run. It depends how long they were not working out for. There's many different factors. If anything, you want to start out slow. Run a half a mile, see how you feel. Then, gradually, we say 10% increase from there.
See, I think this is an important thing to discuss with your chiropractic physician because, you could go back to a gym, but of course gyms are commercial. And, and I know they're trained in exercise and how to use the equipment, the people there. But when it comes to your health and recovery after an injury, that's a great reason to go and consult with your chiropractic physician, I would imagine. Dr. Mitchell?
Yes, exactly. That's something where if you were doing something, we don't know how you got injured. Maybe you got injured doing that workout because you weren't doing it the right way. So by seeing a chiropractor that's trained in knowing how the body moves and certain functional movements, whether it's just doing a simple squat, getting up from a chair, bending over, because we hear a lot of people, maybe it's not even at the gym, maybe they're bending down to get their jeans on and they just feel a little twinge in the back. And by seeing a chiropractor, we can teach them how to functionally move where they're not going to be putting that stress on their low back, because all you need is that little bend and that twist, and you could be knocked out for
Yeah,
weeks.
and not only that, but psychologically, I mean, once you get that fear, let's say you feel that little twitch in your lower back, all of a sudden you get a fear and you're afraid now to bend down, and then you become immobilized, and then that tension, adds to that. So why not go and see your chiropractic doctor and help them put together a plan for you. Now, I love our last question here. This is so fascinating. I'm going to have you guys back. But when a person comes to you and they are overweight and they do want to, control their weight, what's the approach a chiropractic physician takes with that? Because I know you run a very holistic practice. You don't just see the injury. You see the whole person and their quality of life. So if somebody comes to you and they say, look, I can't move. I've got 50 extra pounds.
Well, one thing is, we would get them on an exercise regimen to help lose that weight. And then that's not the only thing. You need to get their diet corrected. So we actually have a nutritionist that's actually on staff in part of our team in our office that comes in, and she's very, very great with helping you lose the weight and lose it in a way that you're going to keep it off. And it's not maybe a 2-week thing or a 1-month thing. It's a lifestyle change that you're able to keep up with.
Is there one particular nutritional approach that a chiropractic physician takes, like low carb, or does it depend on the person and their
Depends
eating?
on the person.
We try and do a lot of clean eating, no preservatives, try and make your own food. That's pretty much, I would say, the one you want to stay away from any, artificial stuff.
I'll tell you something. When I was growing up, my father is 92 now, and he's still going strong, and he's dancing and doing all that kind of, he does yoga. I mean, he does everything. But he one rule we had in the house, if anything had preservatives or dyes in it, out it went. So I wasn't allowed to eat like commercial peanut butter or,
Wow.
Everything had to be organic. I mean, they grew their own stuff. Wow. My grandmother had the big, garden with. So, yeah, I love that approach. It really, really helps a lot, doesn't it? Mm-hmm. Because I think one thing we have to, and I know we have to close, talk about is we all have a personal responsibility for our own health, too, right? We can't just go and plunk ourselves in your office and say, make me better forever. You got to do some work, don't you?
Definitely. A lot of patients. I wish more patients had that mentality, but...
I love it. This interview was great. I am here with Dr. Candace Pollock and Dr. Max Mitchell of Advanced Physical Medicine Chiropractic and Wellness Center in North Haven on Washington Avenue. Their number, 203-691-5581. Doctors, thank you so much. You were great guests, and thank you for sharing all your information with us this morning.
Thank you for
no
having
problem.
us.
Anytime. Thank you.
All right, we're definitely going to have you back. And thank you for listening to The Art of Living Well and for listening to 88.7 West Haven WNHU.